There is a recent study from August from the head of public health at Harvard, so pretty science-based individual, I would assume, who put together a literature review of over 40 studies on acetaminophen in pregnancy and Tylenol, and concluded that there is some level of concern. It's not consistent, not every single study, but the majority of good studies do seem to lean in the direction of a small but appreciable risk of an increased risk of autism from Tylenol use in pregnancy, and people use it like it's candy sometimes. And every medicine has a risk, and we should be conscious of that. And we're very conscious to tell people not to use Motrin or ibuprofen, or not to use too much aspirin, and those have known complications. And I don't know why Tylenol would be any different.
So first study, international study done on autism, 1979, 1 in 2,500 children diagnosed with autism. 2000 in the US, we leapt to 1 in 150. Today, the latest CDC numbers, 1 in 31 in the US. So we've gone from 1 in 2,500 to 1 in 31 in the space of 40 years.
Yeah, and 1 in 12.5 boys here in California, which is insane. And you still get this media context of, we're just better at diagnosing.
Yeah.
That's not true, right? I mean, we are better at diagnosing it. There's no question about it. That's one part of it. But there aren't 1 in 12.5 adult males in California with autism. It is happening more. Everybody who works with kids knows that.
And today we're very pleased to welcome a very special guest, Dr. Joel Gator Walsh.
Great
Welcome.
to be here.
Thank you for having me here.
Who is a board-certified pediatrician, epidemiologist, and founder of Integrative Pediatrics in Los Angeles. Known to nearly 300,000 parents online as Dr. Joel Gator, he's been featured in CNN, Forbes, The Washington Post, and NBC, and is the author of Parenting at Your Child's Pace and Between a Shot and a Hard Place. Those are 2 different books. Dr. Warsh stands out for his integrative approach, blending modern medicine with prevention, nutrition, and transparency. At a time when chronic illness in children is rising and trust in medicine is declining, he believes the answer is slowing down, simplifying, and restoring respectful dialogue. Today, we'll explore what really matters in the earliest years, from newborn interventions, toddler health challenges, and even the vaccine conversation, through the lens of empowering parents to raise kids at their own pace with resilience, confidence, and health. Welcome.
Thank you.
Dr. Joel, so good to be with you. We really appreciate balanced insight, especially, by the way, in context of what the administration just went to town on literally yesterday. So by the time this airs, it'll be a few days from that point. And before we talk about why you wrote Parenting at Your Child's Pace, I love the title, it is very timely. Dr. Murray always sets us off with some sort of themes and trends of the day, much of which, by the way, are also related to what is going on currently. So, Dr. Murray, what do you have for us today?
So we all know, and especially, the first 3 years, the first 7 years, this is when the foundation is laid. This is pretty much where health is born and solidified. So we're going to look at all of these different, aspects of from conception through utero, through birth, infancy, and touch on, what are the key points, what's most important, what should parents look out for. In the context, if we go to the next slide, with the understanding that by the age of 7, every child's brain is pretty much built, 95% the size of an adult brain by the age of 7. So what we do, what we create, what we form in those first 7 years is pretty much what we have to work with for the rest of the life. This was a study I just want to mention. It's the first and the only one that I know that's been done of its kind. This is the Environmental Working Group, 2005. They took 12 pregnant mothers from 12 different states in the U.S. The moment of birth, they took the umbilical cord from each mother and then screened it for over 3, 4, 5,000 different industrial chemicals. So the average, if we go to the next one, 287 chemicals, industrial, heavy metals, plastics, pesticides, chemicals. That was the average in each of those 12 mothers and babies' umbilical cord blood.
Shocking.
So when we realize this is what the starting point for a baby being born in today's world is.
Right.
So far different from 30, 40, 50 years ago. And if we understand this, then we can start to understand as parents and caregivers and physicians what we need to know and what we need to do to protect children and also undo what they're starting off with.
Because that's the point, right? It's not always fatalistic. There's a lot you can do to reverse
The whole thing
some of the
is-
impact.
Yeah, it's the whole thing is just understanding what's going on.
Right.
Why children are being affected so much in this day and age. And this is Dr. Joel's. This is a very nice way he's broken it down in terms of what to focus on: stress, exercise, environment, diet, sleep, which spells out nicely seeds.
Not to mention that extends very nicely into the microbiome, right?
Definitely.
Seeding the microbiome. So what the heck happened last night? Or yesterday, rather? September 22nd with the big announcement. I think a lot of us anticipated, can't wait to talk to you more about vaccinations, by the way, that's coming up in the show. But I think the anticipation was, somehow some justification as to the position that vaccines might be contributing to predisposition of autism. It's just multifactorial. You'll explain that to us. But acetaminophen?
Well, it was a big week, right? And it was a big press conference, and it's still very fresh. But I think a lot of people are certainly frustrated, and there's a lot of differing opinions on with that this announcement. You're talking about seeding. We talked about this for a while. I mean, Secretary Kennedy said months ago that we're going to have a big announcement in September, and I think a lot of individuals were waiting very diligently to see what would be said, what new evidence they had, what would they be coming out with, and realistically, what they came out with yesterday wasn't really new. I mean, they definitely did focus on acetaminophen and Tylenol and also leucovorin, and I think that both those things are reasonable. I think that those are both things that when people are attacking the administration, it's not really reasonable to attack them on that. I mean, there have been plenty of studies on acetaminophen. There has been a lot of concern around it for a while. There is a recent study from August from the head of public health at Harvard, so pretty science-based guy or individual, I would assume, who put together a literature review of over 40 studies on acetaminophen in pregnancy and Tylenol, and concluded that there is some level of concern. It's not consistent at every single study, but the majority of good studies do seem to lean in the direction of a small but appreciable risk of an increased risk of autism from Tylenol use in pregnancy. And with that study, I think it's completely reasonable to provide caution, to provide concern. With the rising rates of autism and the concern around autism, we should take precaution. And Tylenol is the most used, or one of the most used medications. It's certainly the most used pain reliever in pregnancy, and people use it like it's candy sometimes. And every medicine has a risk, and we should be conscious of that. And we're very conscious to tell people not to use Motrin or ibuprofen, or not to use too much aspirin, and those have known complications. And I don't know why Tylenol would be any different. So I think that's reasonable. I think there's a biological plausibility. It's not 100% for sure. There are studies that don't show it. There's a lot of pushback with the Journal of the JAMA study, Journal of American Medical Association study from last year. That was a massive study, 2.5 million kids, and they didn't actually find an association. They studied for genetic differences, so it looked at siblings, and the actual findings didn't show after that. So there's more research that needs to be done, and it's not definitive, but totally reasonable to make the announcement on that. Totally reasonable to warn people. Totally reasonable to not take Tylenol if you don't absolutely need it. Fevers in pregnancy, also a risk. Severe pain, also a risk. So those are things you have to weigh, and sometimes you need to take a medication. Sometimes people, we know that antidepressants can cause issues in pregnancy, but you might need it. Your blood pressure medication might cause an issue in pregnancy, but you might need it. So you have to weigh with your doctor whether the risks that are known from the medication are still warranted, given you still might need the medication.
Right.
So I think that's the way we have to look at everything, and that's reasonable. And also leucovorin, there has been tons of research on it over the last 5 to 10 years. It's become much more popular. A lot of mainstream doctors are using it and have found great benefits for some patients. So I think it's a very reasonable thing to offer patients, to bring awareness to discuss more so people can try it. It's basically a supplement, and so why would we not want to offer that with something that's minimal risk, and everything has risk, that's very minimal risk. And if you're going to see great benefit for some kids, and that's a wonderful thing to promote. And we want more research. I don't think any of this stuff is definitive, but we want to discuss this. And I think it's the first time where we really had this kind of conference on autism, an acknowledgement that it's increasing, an acknowledgement that we want to do more to look into it. And there was a lot of discussion around increasing research. So I think all of that was good. And I think the motivation behind generally having a conference around autism and trying to look into it is good. I think not everything that was said in the best possible way. And I think some of the things were, maybe overstated or said in ways that maybe could have been done better. But ultimately, that's the reasoning behind it. And I'm not, totally upset. I think it's very good based on where I've been that we are talking about this, but just not maybe the way that I would have personally done it.
Sure. Well, yeah, so sometimes the message is as important as the messenger.
Sure.
And
I think opening the door is the most important thing to the conversation.
That's science.
Yeah.
Remaining open, having the conversation. You've written a lot about this, and you've lectured a lot about this, the incidence of autism.
So, this is to put in context what you're talking about, Dr. Joel. So, first international study done on autism, 1979. 1 in 2,500 children diagnosed with autism. 2000 in the US, we leapt to 1 in 150. Today, the latest CDC numbers, 1 in 31 in the US. So we've gone from 1 in 2,500 to 1 in 31 in the space of 40 years.
Yeah, and 1 in 12.5 boys here in California, which is insane. And you still get this media context of, we're just better at diagnosing.
Yeah.
That's not true, right? I mean, we are better at diagnosing it. There's no question about it. That's one part of it. Yeah. But there aren't 1 in 12.5 adult males in California with autism. It is happening more. Everybody who works with kids knows that. Yeah. And two things can be true at once. And we have to acknowledge that it's happening more, and especially that more severe autism happening more, which the most recent data shows about 25% of cases have very severe autism, severe verbal communication issues, and that's important. Yes, some kids with autism do fantastically well and don't need any support, and that's wonderful, but a lot of families do. And with the rise at the rate that we're seeing it, some small part of it is probably better diagnosis, but it's just happening a lot more, and we need to figure out why. And looking into Tylenol, totally reasonable. We should be looking into many things. And to me, the conversation should have been, well, here's the research we have around Tylenol and acetaminophen. Seems like a reasonable thing to avoid if we can. Here are the other 10 things that we're looking into. We're going to get more research. They did talk about getting more research, but it should have been the focus to me, because ultimately we do need to look into this more.
Absolutely. And as we remain balanced in this conversation, I just want to bring up this whole notion of causation and correlation. So correlation doesn't always, and actually quite often, doesn't equal causation. One of my favorites ever is that the per capita consumption of margarine in Maine correlates very highly with divorce rate. Like, it's almost a perfect. So is margarine causing divorce rates in Maine? No, or at the very least,
most likely
no.
not. Yeah,
right. But could it warrant further investigation? Maybe, if you could sort of logically extrapolate the reasoning behind that. But one thing you said just now, and something the naysayers are now currently arguing about, or the opposite side, this is not a black and white issue, and it shouldn't be a red or a blue issue. But what they're saying is 60% of pregnant women are taking Tylenol. Those are their numbers. And if 60% of women taking Tylenol doesn't relate to 60% or close to that rate of autism incline, because these numbers are staggering. Part of that's because they're also maybe taking it occasionally or very conservatively. I think what we're concerned about are parents or moms, pregnant moms, taking it all the time, or doses beyond what are considered. Because now what we know is a single dose is actually hepatotoxic, right?
Right, and that's absolutely correct. And that goes back to the reality, which is autism is multifactorial. There are many things involved, and genetics are certainly involved, like with anything. And so just because you take a medication, 100 people can take the same exact medication at the exact same dose, and most of them will be fine, and maybe one isn't. And ultimately, we need to figure out who that is. But when you have a medicine like Tylenol, where let's say 50% of people are taking it, and some people are taking it, like it's candy, like it's nothing, then that is where it is important to make these announcements, because people have to understand that medications have consequences. Tylenol absolutely has consequences, and with that kind of acknowledgement, then maybe people won't take it just because. They'll take it when they really need it, but a little bit of pain, a little bit of a headache, a low-grade fever, maybe those are not the times to take medicine. And that's no different than when I talk to my families in the office, right? This isn't about autism. It's my kid has a cold and a low-grade fever. You don't need to take Tylenol. Like, there's no reason to do that. Fever in general is your body's natural response. It's a good thing. It's helping you to fight off the infection, and presuming it's not a really, really, really high fever, 105 or above, or they don't have very severe symptoms, let the body do its thing. You don't have to give a medication. You don't have to suppress what the body is naturally doing, and they'll get better on their own. And I think if we echo that message, then that's no different for this than almost any medication. But I think that the messaging for so long in America especially has been, oh, we have a pill for everything. You have a little bit of headache, you have a little bit of pain, a little bit of fever. Here, this medicine, take it. It has no side effects. And that's not true. And this is showing that, because even if it's a very, very small effect, which is what the research shows so far, if everybody's taking Tylenol, then even a small effect has a huge difference, because there are some people that are going to have genetics or an environmental situation where that's going to throw them over the edge, or maybe it's when you take Tylenol, or maybe it's Tylenol mixed with the reason why you're taking Tylenol that leads to autism. I don't know. That's what they're going to have to figure out. But when it's something that everybody's taking, even a little risk is a huge problem, and so we do need to understand that.
Something that you and I are keenly interested in, the genomics, the backstory of autism, because again, this is multifactorial. You write about it in Parenting at Your Own child's pace. Genetically, these children in utero and beyond, they're susceptible to poor detoxification and methylation, right? These pathways, right? And and part of the message. And by the way, I just have to say, I've heard you say this so many times. 4 things we have to ask ourselves in medicine, and you practice this daily, Dr. Joel, is what is the benefit of taking anything? What is the benefit of not taking that thing? What is the risk of taking something? And what is the risk of not taking that thing? And if you ask those 4 questions, but the problem is so far, they haven't properly evaluated what is the ultimate risk of taking that thing.
But if we understand and just delve into a little bit the methylation that you brought up, just a very easy understanding of that is that we all have a detox pathway to work with pesticides, chemicals, heavy metals. Some people's pathway works better than others. Some people need more of the B vitamins in different forms than others for that methylation pathway to work. So we get to the notion that every child, every adult has a different threshold of capacity of what they can withstand from the environment before that detox pathway is overwhelmed and doesn't work anymore. And that's when things start building up in the body that shouldn't be building up in the body, like the heavy metals, pesticides, chemicals, which can all be neurotoxic, which can all contribute to the nervous system and brain not functioning properly. So this methylation detox pathway, it's just the understanding that everybody has a different body burden, a different threshold, and if we're aware of that, we can address it as pediatricians and parents.
Right.
Yeah, and even more than that is as a society, right? I think that's where we're getting to. I mean, we have this chronic disease epidemic. It's exploding, and adults, the latest figure, 75% of adults have a chronic disease. For kids, it's around 50%. So we have to acknowledge that this is a big problem. And like you mentioned, everyone has a different ability to detoxify, and we have amazing bodies that can. We have great livers and kidneys, and we get rid of a lot of toxins, but we're in a different world now. We're in a world where there are just so many chemicals and so many toxins, and you mentioned it right from the start. We're born being in a soup of chemicals.
Right.
I mean, that's right there. So especially if you have a not so great detoxification system comparatively, well, the world that we live in right now might just be too toxic for you, and it might spill over into some sort of condition, or maybe it affects your kidney or livers, or turns into an autoimmune condition, or whatever it is. Like, that's what we're seeing now. And when we talk about vaccines or Tylenol or all of these things, it just all adds to the things that our bodies are exposed to. And depending on your specific genetics and makeup, that can affect us in different ways. And if we can acknowledge that, if we can discuss that openly without censorship, without anger, then we can get to a place that's better. Like, what we know for sure, kids are sicker than ever in terms of chronic disease. We know that. Adults are more sick than ever for chronic disease. We have to acknowledge that so that way we can discuss it. And it can't be something where we can't say, oh, well, how do vaccines relate to that? How does Tylenol relate to that? Those are reasonable questions. They're not the only thing. There's a lot going on in the world. There's a lot that we're exposed to, but these are things that we're putting in our body, and we're talking about the most common medication or something you're giving to kids like vaccines multiple times. parents have concerns, and we have to listen to those and address those concerns and talk about it and then research it more, and also be honest and say what we do and do not know. We don't have to know everything, but we do need to discuss it. And before we move on from the Tylenol, I think, again, it's really important to say this isn't about shaming parents, right? This is just new information. You do what you know when you know it. And if you took Tylenol when you were pregnant, most likely didn't do anything, right? It's still a very small risk. But these are things that we need to know. If there is some sort of increased risk, we want to know that moving forward. And you did the best that you could. You took the medication that was said to be safe, and maybe now we have some new information that says it isn't as safe. But you shouldn't be hard on yourself or feel bad or shame for causing your kids autism or something like that. It's so much more complicated than that. It's so multifactorial, and I think that it's not about shaming anyone, but about getting better information for the future. So I think that's really important.
And applying it.
I loved your post today, by the way. You're prolific, and I don't know even how you have the time to do this, but you
it was
posted,
early morning, as you see.
Yeah. Well, and and this is just, I love how you do it. You go back to pen and paper. But what this says is, I don't know which moms need to hear this, but you did not cause your child's autism, because it is so multifactorial. Part of what we're doing today is educating parents as to what more they can do so as to reduce the risks and or contribute to optimal outcomes in ages 0 to 7, as we do on the first 7 years. But I love this content because people do need to hear and understand this, because it is not their fault. By the way, again, just before we get off Tylenol, it was a very nuanced position this one reporter took, where RFK then stood up to President Trump and said, let me just take this. So it was something along the lines of the incidence and increase in incidence. What has to happen here, as science, which should invite, is cohort analysis. So I loved his rebuke to this, which was, if this incidence was actually sort of ubiquitous, it would translate over to the older generations. And yet in our, age groups, male, female, you name it, there is not this increased incidence of autism. It's strikingly increasing in younger generations.
And not just autism, what you mentioned before, Dr. Joel, in terms of the actual chronic rate of disease in children and adults. So if we look back, Journal of American Medicine did a longitudinal study, 2007. 40 years ago, 1 in 50 children in America had some sort of chronic medical condition, whether on medication, under the care of a doctor, ongoing. We jumped to 2007, it was 1 in 5. So we've gone 1 in 50 to 1 in 5 kids in the space of 40 years. And then the latest, like you mentioned, is 1 in 3, getting to 1 in 2 in terms of any sort of chronic disorder. So it's across the board in this generation, and there has to be common denominators that we can all look at.
Right, and isn't that our job?
Right?
Like, isn't that my job as a pediatrician, as a public health agent? Like, okay, why?
Yeah.
Why is it happening? Don't deny it. Why is it happening? Let's fix it.
Exactly. So you mentioned the word already, and it'd be great to dive into it with you in terms of vaccines. As just looking at the whole picture, what are your thoughts?
Yeah, I think it's important for me to start with my position, and I'm not against vaccines. I think they've done a lot of good over the years, but I think that it's really frustrating, the conversation we've had around vaccines, especially in the last decade. There's a lot of censorship. We haven't been allowed to talk about it, and my personal belief is nobody should be forced to do things. I think we should have conversations, just like we do with everything else in medicine, and educate, and then families should be able to make the best decision that's right for them, and that's my personal belief. In my office, we have patients that do the regular schedule. We have some that go on a slow schedule, some that don't do it. Most at least do a slow schedule, but ultimately it's up to them. And I never tell people what to do. I don't tell people what to do in my book. I don't tell people what to do in the office. We just talk about it and come up with the best decision that makes sense for them. And it was so censored for so long that it was something I talked about in the office, but never on shows, never anywhere else. And during the pandemic, I got really frustrated, like a lot of people did, and it really pushed me over the edge to want to write about it. And I was getting just more and more questions about vaccines because it was so censored that I felt like I really needed to do the research and look into what exists and what doesn't exist, so that way I can talk about it in the most, educated way possible, given that it's such a controversial topic. And ultimately, there's just a lot that we don't know, but there's a lot that we do know, and I think it's important to have conversations like this, to have balanced conversations, because we want to protect kids from infectious disease, but we also want to do it in the safest possible way. And I think it's really important that we can have conversations where we talk about safety and don't have an arrogance that I think medicine has, that we have the best possible vaccines ever, we've studied everything and we know everything. I think we can always do better. And with a chronic disease epidemic like we're talking about, when you're giving kids more and more vaccines that affect your immune system, that's literally what they're meant to do. They're supposed to stimulate your immune system to protect you. It's also reasonable to have questions around what sort of negative consequences, if any, they could have, given we have an increasing rate of chronic disease, and we should be able to talk about that, and especially in the setting of the actual research, which mostly doesn't look at anything long term. Most of the studies are very short term. They're done before they hit the market. And when we're talking about things like autism or autoimmune conditions or allergies, these things take years to develop. And we don't have a ton of research on that. Even if we say that we do, we really just don't. And I think we need to be able to get more of that.
That's
Absolutely.
great. And the same thing where, every child has their own fingerprint, their own face. Bioindividuality, meaning some children are going to react differently to the vaccines, to different vaccines than others. And again, we come into those sort of detox pathways. How well can the body handle that? How well can each individual child handle that? And knowing that it's not going to be across the board the same.
Yep. 2-pointed. Yeah.
Can I just go on that before you go on the 2 points? Because I think that's such a great point. And to me, that bioindividuality is so key to the future of doing vaccines more safely. I mean, ultimately, right now, it's vaccines are safe and effective. That's what we've heard for years. And nothing is 100% safe. And parents are more skeptical about vaccines than ever. And the way to move forward is to figure out, okay, who are the kids that are susceptible and why? Like, what are the genetics? What are the detox pathways? What are the nutrient deficiencies? What are the reasons why you might have a reaction? And then figure out who those kids are. So those are the kids that maybe you do something a little different, or maybe those are the kids that don't get vaccines, or maybe those kids go slower, whatever it is. That's going to give parents more confidence to actually do vaccines. But you have to at least first admit that they can cause a problem in some kids. And for years, it's this pushback that they never cause an issue, and I don't think that's true. I think they cause more issues than we give them credit for. It's not extreme, but I think there are certainly more issues than we give credence to for those vaccines.
Well, thank you for being, I would just say, not just super educated, well-informed, and doing what you do, but brave to write that book, because you could quite quickly put yourself into some hot water, and I'm sure there's been some pushback. But the 2-pointed question I had was, can we all agree, at least at this table, that a child, regardless as to schedule, decided, should not ever receive a vaccine if they are not well?
Yeah, I don't think so. I mean, that doesn't make any sense, right?
Yeah.
Why would you give a kid a vaccine if they're sick? I mean, unless there's like a very specific vaccine you're giving for something, but that's not really realistic on the regular schedule. Your body is dealing with, virus, a bacteria, whatever it is. It doesn't make any sense to give an added immune stimulus or make your body deal with something else. You can come back a couple weeks later and do it. So
Right. So that was the first thing I needed to get out.
Rule number one.
Right.
Yeah.
Second, what can we offer as to additional support? I mean, it's a loaded question. There's a lot to talk about here and to unpack. But what can we offer parents as sort of a checklist to provide their children before whatever vaccine schedule is decided on?
Yeah, and that, again, it's another great question that's never really been fully evaluated, or hasn't really evaluated much at all. And it should be. What would make parents more comfortable doing vaccines? If you were to say, all right, here are the couple supplements, here are the things you should do, here's the research that we have that decreases your risk of having a reaction. I've never seen that kind of research. So it's something that should be done. I go back to common sense when I get people to ask me those questions. So how do you detoxify? You pee, poop, and sweat. So what are the things that you can do to support your natural detoxification? That is what makes sense to me. And the first thing you talk about, which you already mentioned, is don't go in when you're sick. That doesn't make any sense. If you are sick, just push it back. That's not anti-vax or anything. That's like standard clear medicine. If you're in the middle of being sick, just don't go to the doctor for that. Go for your sickness, and then go back to get your vaccines later if that's what you
Except
choose
the
to
kids
do.
are all often very sick, and so parents are trying to find the time, and then that's not so easy. But it is a significant caveat to pay attention to.
Yeah, I get it.
So I mean, in my clinic, I've always advised, there's the concept of preloading, supplement-wise. So we can actually prepare a child or an infant for the vaccine, give their immune system some extra help beforehand, look at those detox pathways, give the supplements that help that.
Right.
So my sort of easy, ABC is, first of all, vitamin C, great antioxidant, great for the immune system, helps the body detox. DHA, the fatty acids, to help protect the brain. Obviously, the brain is the most sensitive and involved with any of these neurological disorders like autism. So we want to give extra support there. Probiotics, the microbiome can be impacted by vaccines just like antibiotics. So we want to give a little extra protection there. Prebiotics and probiotics to protect that. And then in terms of, actual detox, we can look at B vitamins. You can get that from a multivitamin. If you want to go a step further, you can look at glutathione, something like that. But the idea is, help prepare your child for that. Give them the best opportunity to go through it without any incident.
Yeah, and those are very similar to the list of things that we talk about in the office. Magnesium is another one that I think people consider as well. But yeah, vitamin D, vitamin C, zinc, B vitamins, omegas, probiotics. I mean, all those are quite safe in general. With minimal risk and lots of benefits. So again, has it been studied to say, well, if you take this much vitamin C, it's going to decrease your risk of... No, that's never been studied. But it should be. They should be running clinical trials on even just the short-term risk from vaccines like fevers and severe pain and redness. You can certainly do those studies, and I bet you if you did, you'd have some mild improvements in some of those reactions and like a little bit of a moderation of the immune system. And that's a good thing. Parents don't want bad reactions. You don't want your kid to feel bad after you get a vaccine. So anything we can do to minimize that and decrease any sort of long-term risk, I think is good. So I don't know why we wouldn't do that. And I don't know why we wouldn't study that. Yeah. I think that would give parents more confidence.
Just brings to mind, I haven't thought of this for years and years, but there was a study I came across in Australia, I think it was in the 1960s. The Australian government decided they were going to vaccinate the Aboriginal population with DPT. A doctor was put in charge. He was rolling out the program, and it was unbelievable. It was like 1 in 5 kids were either having febrile seizures, epilepsy, going right into it. So what can I do? I'm ordered to do this, program. So he started giving each child 500 milligrams of vitamin C before the vaccine, before administering, before injecting. Completely wiped out the
side effects. Yeah, that's interesting.
Yeah, it's the only study I've come across.
And it's amazing when you go back in history, not just from vaccines, but just from disease, like how many diseases used to be treated with vitamins. How many diseases were made, much, much worse because people were nutrient deficient. And then as soon as people started to get those nutrients, to eat a little bit more food, have more nutrient density in their food, a lot of those diseases plummeted. And that even gets back to just the conversation around vaccines in the first place, which oftentimes you hear like, vaccines are credited with saving us all from all these horrible diseases, which isn't totally true. I mean, it's really just not. You look at the graphs of most of these diseases, and pretty much all of them, the mortality rates were near zero before the vaccines ever hit the market. It was really sanitation. I mean, really, we didn't have horses pooping in the street. We had better food. We understood what diseases were. We had better hospitals and medical care and antibiotics. I mean, all these things contributed. Vaccines still did something. I mean, if you look at the graphs, you can look at where things were. The mortality, the death was almost near zero, not at zero, but very close. But a lot of the diseases were still around, and the vaccines made a lot of the diseases go down to near zero. So they still had an impact, and I think from a conceptual standpoint, chickenpox is probably the easiest really to conceptualize because most of us, we all pretty much grew up with chickenpox. It was everywhere and generally not super severe, but you could get really sick. I mean, a few kids did when millions of people got it, but most people just had a rash. And that was in our lifetimes as kids. It was still around, even though sanitation was better and nutrition was better. We're talking 20, 25 years ago. But you bring out the chickenpox vaccine in the 90s, early 2000s, and we don't really see it anymore.
Right.
So you can kind of see that difference. And an individual level, was chickenpox super likely to cause you harm? Probably not. But when you talk about a population, we talk about millions of kids, maybe a couple kids die, a couple kids get seizures, a couple kids get meningitis, a couple kids get bad pneumonia. So it does have a net a positive, and so there's no question about the positive. The question is around at what cost. Because when you do a vaccine and you prevent a death, the question is, does it cause more deaths? If you prevent a disease, does it cause more symptoms or more disease? And that's the equation that we have to be able to ask, and you have to be able to ask it honestly. And the piece of the puzzle that I think is missing is these long-term complications, because ultimately, do you want to prevent anybody from getting chickenpox? Sure, that's great, as long as it doesn't cause you long-term issues. And I think that's where we aren't allowed to ask those questions. But but we do need to, because as we add more and more vaccines, things start to compound. And even if it's a 1 in a million risk with a vaccine, which I think it's more than that, but let's say it's 1 in a million, 1 in a million times 1 in a million times 1 in a million, it adds up really quickly to being a 1 in 10,000 or 1 in 100,000 risk of severe complication from a vaccine. And then the question is, well, are we preventing more deaths from that? That's a reasonable question when you start asking more things. It doesn't mean it doesn't. It just means you have to be able to ask that, because otherwise we're going to have 50 vaccines or 100 vaccines or 300 vaccines, and everything's on a U-curve, and eventually something becomes problematic again when you do too much of it.
Vaccinations, the schedule, is the one sort of silo of medicine, in my view, that has yet to catch up to the personalized N of 1 is best medicine. That's where we are today. Every child, every person should be considered before any sort of schedule. It can't be this carte blanche. It drives me nuts also that most of the scientists that sort of are super pro advocacy of current schedule in North America are also cherry pickers of confounding factors, like hygiene. You can't. You have to look at all of these different things. By the way, I was one of the first to read the whole Canadian schedule, back to back in the day. And it just astonished me that in the MMR chapter, and again, this goes back to the sort of 4 questions we asked: what's the risk of and what's the risk of not? But in MMR, if you were to get measles naturally as a child, correct me, this might be updated, but the worst case scenario is like unilateral hearing loss. It's not even death. And then yet maybe getting the vaccine can cause death in some children, in certain situations.
The worst case would be death. You could die from measles. People have, and people did in this last year. So it's possible. It's just the reality of the fear around measles is way out of proportion to what it realistically is. Because if you go back to before there was a vaccine, you had millions of cases and just a few hundred deaths. So no, you don't want any kid to die, right? You don't want anybody to die. But when you're comparing it to something like the flu, which has tens of thousands of deaths, it was not a very deadly disease. The issue with measles is it's super, super contagious. So a lot of people get it if it's out there, if you're not protected. And a lot of kids get pneumonia. It puts a lot of kids in the hospital. So as a public health, there are concerns. And that's where, you go back to, well, we have to go with an N of 1. But that's where the vaccine stuff gets a little complicated, because then there's also a public health aspect to it. And that's the counter argument that many people will make is, well, you're not just always protecting yourself, you're protecting other people. And maybe measles is not going to be very serious for you, but maybe for the kid down the street it is. And if everyone's protected from measles, then it decreases everybody's risk. So that's again where you need to have debates and discussions and nuance, because it's not so straightforward. Measles is maybe the most complicated of the diseases, because at the individual level it's not very severe usually, but on the population level it is. And even again, like we were talking about the announcements, we're talking about breaking up MMR. That was part of the discussion yesterday. That's not even available in America. Right. Yeah. So maybe it needs to be. I've said that many times. I think you should make a measles standalone vaccine. You don't need to stop doing MMR, but I think they should also have a measles standalone. Sure. And maybe for the people that are hesitant, but they do want to protect against measles, you give them that option. It used to exist. It could exist. They just stopped making it.
No, same with it. Brings up another really important point, Dr. Joe. So the concept of multivalent vaccines. There's really not a single vaccine most of the time for kids. You've got DPT, you've got MMR. If you do those at the same visit, you're actually getting 6 different vaccines, not 1, not 2.
Correct.
And that comes back to that bioindividuality, where different child, different threshold, different body burden can handle maybe 1 or 2 single vaccines, but not 6 in one day.
Right.
And if we then look at, if we go back, do you want to address what we've gone from, 40 years ago, the number of vaccines that were routinely administered compared to today and the schedule?
Yeah, those are great points. And again, this bioindividuality, super important, because that was part of the discussion yesterday, and it should be part of the discussion. Like, what is too much? How many are too many? You can't just say we can just have 1 million vaccines forever, and that kind of is the position of science at the moment, that you could just do unlimited vaccines and you're never going to have an issue because they're just such small amounts. But that doesn't even take into account all the other chemicals and all the other ingredients in a vaccine that you're doing more and more. Like the aluminum is and we'll come back to your question because it's a good question about a lot of them. But aluminum is the concern of the day, right? That's the big concern as an ingredient. And you can't say that aluminum can't be toxic, right? We know that. We have standards for aluminum in every other standard. The question is the amount of aluminum in the form that we give it, in the amount that we give it in vaccines, Could that cause an issue for some kids? And there's no reason for me to believe that it could never cause an issue. You can walk by a peanut if you're allergic and smell it, and that like little whiff could cause anaphylaxis in a kid. So maybe some kids have lower tolerance to aluminum, and those kids it could cause a reaction. And also if you had more and more vaccines with aluminum, maybe then that could cause a reaction. So those are the kind of studies that we need to do to figure out where those tolerances are and who is going to be affected. So that's kind of that piece. But back to your question. So your question was about the vaccines. So when we were growing up, depending on how far back you go, there weren't that many, right? You go back originally and there was the DTP, diphtheria, tetanus, pertussis, polio, and measles, mumps, rubella up until the 70s and 80s. That's pretty much all that we had. So you might have gotten 3, 5, 8, depending on how many doses you got of these vaccines. Yeah. And then after the 80s, there was an explosion of vaccines. There were a lot more, and now you're getting upwards of 30 to 50 to more than that, depending on how many flu shots you're getting and COVID shots and all the new ones. So you can get certainly a lot more than we used to get, and
a lot more of the adjuvants.
And a lot more of the adjuvants because a lot of them do have aluminum in it. And yeah, just a higher burden of vaccines for your body to handle, and like you said, so some of the vaccines like DTP, so diphtheria, tetanus, pertussis, that's 3 in 1. But you can even have combo shots. So it's, let's say, Pentacell or Vaxelis, where these are combos of multiple vaccines. So you get the DTP with polio, with hepatitis B. All those can be in Haemophilus influenza. So all those can be in one poke, in one vaccine. That's kind of the standard because you're doing multiple, and it's not an unreasonable question to say, hey, well, if we break that apart, if we don't do as many on one day, does that decrease your risk of anything? Maybe yes, maybe no, but not unreasonable to ask that, given anyone that works with supplements or products knows like the more of something you give, the more chance you could have a problem with it, right? And you have to figure out what that upper level is.
It also isn't the way the immune system works. Like I don't think I've ever seen in the literature a case of a child having measles, mumps, rubella, chickenpox all in the same day. Because when the immune system's heightened, even if they're exposed to that thing, it's typically going to be the natural defense. Deal with this first, and then
it's always going to be one priority.
And again, it's just theoretical. By the way, I think this is the conundrum most scientists have, is these childhood diseases, they occur in the first, where you focus most of your energy and attention and research on, is the first 3 years. And so if we can't get them all in, then you kind of lose the window of opportunity because really risk analysis after 5, 6, 7 is no longer much death, right?
It's also a compliance issue too.
Right.
Yeah, all those things are true. And I mean, the counter argument to too many would be you're exposed to a lot of, you eat an apple and there's all sorts of bacteria and all sorts of stuff on there. You're exposed to a lot of things at one time, and so maybe your body could handle it. That doesn't work for me because it's not the same thing as being injected with a bunch of things. It's artificial. It's not a bunch of diseases that your body wasn't meant to handle. So I think both points are logical, but I don't think it's simple enough to say, well, you just eat an apple, you're exposed to a million things, that's fine, we can inject you with 300 things. Like that, those two things are not the same. You're bypassing the normal immune response, you're injecting something, not to mention it's exposed to all the other things in that vial, it's artificial. So I think that those two things are not equivalent. It could be true that your body could handle them all no problem, but it also could be for sure true that for some kids you can't. And I don't think, again, that's unreasonable to have these discussions. That goes back to why I wrote the book in the first place. We should have these discussions. Like, I don't know the answer to it. Nobody does. We haven't really studied it appropriately. We just say that they're safe, but I don't think that's the whole story.
So here's where we do have the answers, though. And this is just such an easy, slippery slope to become gloom and doom over this topic, right? Because the bottom line, what we agree with is there needs to be more research. But this is why, you wrote between a shot and a hard place. But before that, you wrote parenting at your child's pace. And prevention starts in utero. It starts at birth. There's a lot of things to do that parents can stay focused on in the positive to build up a child's immune system, to make sure they're getting the right nutrition. For example, one thing you write about is a 2-minute delay in cord clamping, which is something you ask your OB-GYN about, can mean years of iron protection. How?
Yeah, I mean, well, even before I get to that question, that's the point, right? I mean, that's why you get into pediatrics in the first place, is to prevent, it's to discuss. It's not all about doom and gloom. I mean, we're living longer than we used to, right? We're not living to 40 anymore. We're living till 70. So there's a lot of good stuff that we have done, but we're seeing chronic disease rates skyrocket. and we're seeing life expectancy go back down. So maybe we're not doing everything the best in the last few years, and we have to have a little humility to say, all right, let's discuss these things, and let's look at what we actually can do, because there's a lot that we can do. And it's not just about medications. It's a lot of it is this basic foundations that we need to discuss. And, you mentioned something like cord clamping. Well, we have a lot of medicine now. We do a lot of things that we never used to do, and most cultures around the world, they don't just clamp off the umbilical cord right away. They let the blood flow to the baby, and because they're getting more blood, they're getting more iron. So, and we see a lot of babies these days with iron deficiency, especially around 9 months, and that's why we test for it. So the research is fairly clear. When you look at cord clamping, you don't have to wait for hours, but you wait for an extra minute or two instead of rushing to just clamp it off. They get more blood, and it increases their iron stores and decreases the risk of iron deficiency. So these are just basic, simple things that if we don't over-medicalize it too much, then we can see some benefit. But again, not all of medicine's bad. Like, we used to have a very high rate of death in childbirth, and now we don't. So there's a lot of good parts to medicine too, and it's not to demonize everything. It's really to try to take the best what we get from medicine, but also not to make fun of or poo-poo the woo-woo out there, because there's a lot that used to be done and lots that's done around the world that maybe we can go back to a little bit.
And so, baby's born, then we look at, vaginal birth versus C-section, breastfeeding versus formula feeding. Your thoughts?
Yeah, again, great topics that over the last, 50 years or so, we went way away from natural, right? We went to, mom's tired, so let's just do formula. You don't need to breastfeed, it's fine. Oh, well, I want to have my birth on Tuesday, so we could schedule a C-section. That's fine. I want to do it, so that we have the right sign. I don't want a Taurus. I want a Virgo or whatever. So let's do it on this day. Like, these are things that you could do now, right? Because we have medicine, and the reality is that everything has a risk and everything has a benefit, and you have to understand those things. And we know very clearly now. There's very good data that shows that vaginal birth, the bacteria that you're exposed to, has a profound effect on your long-term health. Doesn't mean that you can't have a C-section and be healthy, but we do see that rates of asthma and allergies and autoimmune conditions are lower in vaginal birth. Same thing with breastfeeding. There's massive benefits to breastfeeding if you can. If you can't, we're lucky we have formula. People do just fine on formula, but you have lower risk of allergies and asthma and autoimmune conditions and cancer and all the long-term things that we look at, which makes a lot of sense because you're meant to have your mom's milk. That's what we were biologically meant to do. That's how we've evolved, and also you're getting protection from antibodies that you just can't get from formula. So we should always prioritize that if you can do it.
Right. And you talk about colostrum often. And what is that doing to prime the immune system?
When we look at how nature set it up those first 2 to 3 days, it's not breast milk, it's colostrum. Why does the baby need the colostrum more importantly than food? And when we look at that, the colostrum is actually what signals the baby's immune system to start functioning independently. Before that, through the umbilical cord, it's all been the mother's immune system. Right. When the cord's cut, now the baby's on its own. The colostrum is actually what has peptides to signal the immune system to kick in. Then 2 to 3 days of that, then the food starts coming. So just look at the way nature set it up. Yeah. It's beautiful.
Yeah, and I just want to say on that, and talking about formula or supplements, which are obviously important to you guys, like that's what we're trying to mimic, right? Nothing's ever the same as breast milk. We can't make it exactly, but everybody's trying to make it as close as possible, right? That's what we're trying to do. That's what we're doing with formula. That's what you're doing with colostrum supplements. That's what you're doing with vitamins, right? We're trying to mimic what the body already naturally does to help support, especially in the modern world where we're just deficient in all these things. But ultimately, anybody who says, you should take formula, it's better than breast milk. Like that's not science-based. Right? We want to support people and support the natural, but also support people at where they actually are. And there are a lot of people that just can't do it or, don't get enough sunlight, so they don't get enough vitamin D. And that's where you want the best possible supplements or formula.
Do you guys think it's fallacy, though, that some women can't breastfeed and it's more, maybe, I'm not saying that doesn't exist, but is it maybe a little bit more that the latch or the training around breastfeeding is really not appropriated, postnatally in the hospitals?
I think most of the time you can, but there certainly are situations where you cannot. I mean, sometimes there are, women that had breast surgery that can't do it.
Right.
It doesn't work for whatever reason. The baby doesn't latch. They're not feeding well. Maybe they're in the ICU, and there are many reasons why you could have difficulty breastfeeding. And certainly, many moms that I work with that have all the best of intention of doing breastfeeding, they just can't do it. It hurts too much. They're not producing enough. Whatever it is. So there are certainly situations, but I think our goal, especially as physicians in public health, should be to promote and encourage and support every mom who wants to breastfeed, to help them to do that as best as we can. And providing that support should be our foundation to help them get to where they want to get to. If you can't ultimately do it, that's fine. That's what
there's no
is for.
shaming here at all. And to the end of supplementation, if you can't, and you've gone through the motions, of latching, technique training, and so forth, there's colostrum in supplement form.
And it turns out that the cow colostrum is exactly the same protein peptide structure as human, so it's completely safe. So we can add colostrum, we can add the DHA to the formula to make sure they get those essential nutrients.
Yeah.
But I just want to go back one step before we move on. In terms of the C-section versus vaginal birth, what is it with the vaginal birth that's happening in terms of the microbiome and the immune system that you mentioned with the allergies and eczema?
Yeah, our understanding now is that they're getting exposed to all the bacteria through the vaginal canals, and they're swallowing some of it. It's getting on their skin, and so that's seeding the bacteria, the good bacteria. I mean, we hear bacteria, we hear a bad word, but it's really not. I mean, we're mostly, we're a lot of bacteria in us. Most bacteria is good, and unless it gets to the wrong place. So we're getting that bacteria from mom that we're naturally supposed to get, which is helpful and protective because we're getting all these great bacteria, which from a C-section you don't get because you're not exposed to it. So can you be super healthy with a C-section? Sure, but you're not getting that initial bacteria that you were always meant to get from mom. That's the way we developed and evolved over the last 100,000 years or millions of years or whatever it is. So that's just what we're meant to do, and we're kind of bypassing that with a C-section, but also we're sometimes bypassing a baby that wouldn't survive. So you have to balance those two things. Where sometimes modern medicine, not getting that bacteria, maybe that's not the most important thing if you wouldn't survive, right? So
yay or nay, 'cause I see a lot of doulas and other health experts online talk about if it's C-section, take as best you can, clean hands or however you can do it hygienically, a vaginal swab and smear the baby's face.
I think that's fine if you want to do it. I don't know we have enough research so that makes a huge benefit, but again, you're giving the bacteria you already would. It's not exactly the same because I imagine giving birth and that whole process affects everything, so it's probably a little bit different, but I think if you want to do a swab and put some bacteria on them, that's totally fine. You're going to be putting them on your body anyways right
skin
after.
To skin.
Skin to skin, so it's probably good.
Was I crazy? I may have been, as a parent, whisking both my kids away. I just wasn't convinced about the vitamin K. It was concerning to me. So I followed them because they were going to do it anyway. I had to follow them out of the operatory and say, no, I said no, and I signed off, and no. Yeah. They really wanted to give it. But I just wasn't convinced. Was I nuts, or is there some, controversial evidence around, maybe being concerned about too much K right away at birth?
So, the first thing to say is you're not crazy to follow your kid around. I think that's very, very important in the hospital. I think if you can, you should always be with your child at all times, especially if you have requests that are not the standard. If you're not wanting something like vitamin K, then you do want to be there at all times to make sure that it's not given by accident or given by someone who doesn't realize that you don't want it. So being there does make a huge difference. The reason why you give vitamin K to a newborn, there's a small but real risk of bleeding. Sure. So brain bleed or internal bleeding, but brain bleeding being the most concerning. And it was about 1 in 10,000 back before they started giving the vitamin K shot. And while it's not a huge risk to your baby, if it does happen, obviously it's super severe if it's a brain bleed. They don't always catch it right away, so they decided to give the vitamin K shot because you don't have a lot of vitamin K when you're first born. And ultimately, if you do give that shot, it decreases your risk to almost zero. So there's certainly a benefit there. Risks in terms of long-term, I don't know. Again, we don't know. Maybe there is a reason why babies are born with low vitamin K that was for evolution over time, and maybe we don't have those reasons anymore. There's also oral vitamin K, which people do, which decreases your risk of the bleeding, but just not as much as the shot. So the shot's recommended.
That's what we did. And we're not talking about genes that may predispose to hemophilia and all that stuff and bleeding disorders. But my logic was simply, and maybe I was a little more crazy, than I should have been around that. But my logic was, we could use the oral, but there was probably some benefit to this, just as you mentioned, some evolutionary benefit to, bleeding. And also, by the way, perfect example of N of 1, personalized medicine. Like, I feel like in some complicated cases, or the labor is belabor, it's literally gone longer than it probably should have. Maybe there was some trauma or cord, all these things that indicate vitamin K. I don't know. Anyway.
But it does happen. You can have a perfectly healthy, no traumatic birth, and there's still a risk, though small, and that is where I come back to. That is where you have to decide your risk versus benefits, and each person has to decide what their risk tolerance is, because ultimately there's a risk from every vaccine, and there's a risk from not doing a vaccine, and you have to weigh, do you want the risk from nature, or do you want the risk from the vaccine? And I don't think we have all the understanding of the risk from the vaccine, but I would also say that it's incorrect to say that you don't have a risk. There is a risk. It's a small risk. If it happens to you, it's a severe risk, and people need to understand that. And with modern medicine, we have decreased that risk down to zero. And also, I think it's important to say, just because something's natural, or the way that things are doesn't mean it's good. Pneumonia happens, but we're also happy we have antibiotics, right? So, people used to die from pneumonia all the time, and now you can treat it and get back to your latte 2 days later. So just because we have vitamin K and just because it's not the natural way doesn't mean it's not good necessarily. So those are the kind of, I think, nuanced debates that are important, because, again, two things can be true. You want something to be natural, but also you don't want your baby to bleed in their brain. So
absolutely. Absolutely.
So the baby's born, now the baby's breastfeeding, ideally. Then what's the most important thing? I'm going to bring up the word sleep.
Yeah, I think, well, breastfeeding, sleep, I mean, everybody sleep, right? Parents sleep. Nobody's getting any sleep, and you realize how important sleep is once you have a baby, because you're getting now 2 hours, and now you're going on weeks with every 2-3 hours. So, yeah, I think sleep is such an important part of our growth. We don't recognize it unless you're a sleep researcher, but everybody realizes once you're in that field that sleep is probably one of the most important aspects to our growth and our development and our immune system. And as soon as you aren't getting the appropriate amount of sleep, you get sick really quickly. You're not growing like you're supposed to. So yeah, I think that's a real important piece of the newborn period for parents and the baby.
And you talk about that in the book, parenting at your child's pace, and it's so underrated, sleep is. And we see so much more, stress and anxiety in kids earlier and earlier. And of course, sleep helps to offset that and helps the brain evolve and so forth. But what integrative strategies do you talk about in the book that help build resilience in now maybe we're moving on to the beginning of school-aged kids?
Well, I think, building resilience, we can go back to the seeds a little bit. And I think that the two big things really are food and toxins, or diet and toxins. Our kids are eating such crappy food right now, and we're literally built of what we eat, right? We're literally built of those nutrients, and our food is so devoid in nutrients. It's so ultra processed. Like 60 to 70% of calories that kids are getting now are ultra processed, and they're not getting those nutrients from food. I mean, the food we get, even in the best case scenario, is mass produced. It's shipped across the world. It was picked 2 weeks before it was supposed to be harvested. So those nutrients are gone, and then we wonder why every kid has a vitamin D deficiency because they're not getting outside, or they don't have enough B vitamins or whatever it is. Well, where are you getting those things from? I mean, it's not coming from our food. You're not getting it from your snack bar or your cereal. I think that's such a huge thing to understand. If you don't have that foundation, then how are you going to stay healthy? And if you mix in all the chemicals and toxins that we're exposed to, I mean, there's no wonder that everybody's sick. We just can't handle it.
Yeah.
Right. I love this quote. Real food doesn't have ingredients. It is ingredients, to your point. It reminds me of Michael Pollan's just eat food, not too much, but real. He's suggesting eat real stuff, right? And I think that echoes those sentiments, one of my favorites.
Well, and that goes back to, discussing that you don't want it to be too complicated. We don't want it to be too complicated. Most people that are healthier in general these days, they focus on these basic things, like reading ingredients, focusing some degree of their day on health and wellness and being mindful of those decisions, and buying food from local producers, farmers markets, whatever you can do where it actually, where it comes from, You know that the food is actual ingredients. You're getting an apple, but it's a local apple. It's in season. It wasn't shipped in from some other country. Like, it's fine to get stuff from Mexico. That's fine. But, like, it's not picked. It's not the in-season thing right now, and you don't get the same nutrients. And everybody knows that. Go to any farm, pick a fruit, eat it off the bush or off the tree. It's a very different thing than you get in the grocery store. Even in the best places, even in Fancy Air One or whatever it is, you can't get the same thing as you go to a farmer's market. It's just not the same thing. It's totally different when you eat it fresh. And that's because the nutrients are the way that they're supposed to be. And if we don't do that, then it's no surprise that our bodies are unhealthier and unhealthier. And that's what we're seeing.
And I always like to mention this, to really put it in perspective for children. How much more nutrients, essential building blocks, vitamins, minerals, essential fatty acids they need than adults, because they're growing, they're living, they're going to school, they're learning. They're working twice as hard as us, most of the time. And when we look at the food intake, the average child, pound for pound, eats and requires 2 to 3 times more than what we eat, pound for pound, because they need those nutrients. So what's going in is even more critical, more important, because they need 2 to 3 times more than what we do as adults. If it's not the right kind, then the consequences happen, the bad consequences happen even faster. If it is the right kind, then you see the benefits coming on. Yeah.
And we get it with a plant, right? I mean, if you don't give a plant sunlight, it dies. If you don't put in, water or fertilizer or whatever nutrients, then it's not going to survive. But kids are no different. We're more complicated, but if you don't give it sunlight and you don't get the right nutrients in there, it's not going to thrive. So it's not rocket science. Like, this is what's happening, and we are not setting our kids up for success. We're setting them up to fail. Our society has set us up to fail, and maybe going full circle back to where we started with kind of announcements, like, there are things that we have to do on the individual level, and there's a lot that we can do, but then we also all collectively need to kind of push back and push for some bigger changes in society, where we're going to move hopefully towards more local fresh food and natural products and decreasing chemicals. And that's where either pro Maha or against Maha or whatever it is, whatever you are when it's political. I mean, health shouldn't be political, but at least we are talking about health, and we might not agree on every single policy, but ultimately everyone has to come together for policy for our kids. And nothing is going to really change until we tackle those bigger things and really do start to support fresh local food and regenerative farming and these kinds of things versus the toxins and chemicals and mass production. I mean, we need enough food for everybody, but we also have to transition back, I think, somewhat to a little bit more local and have that be available for our kids because they're sick and they're getting sicker, and as are adults, and we have to do something about that.
Is there a top 3 sort of deficiency list that you see in your clinical practice, whether that's sleep, nutrient, lifestyle factors, that is quite easily correctable with a 1, 2, 3 punch list?
Yeah, vitamin D, I think is a big one. Getting outside is huge. I mean, almost everybody's vitamin D deficient, even in California. So I think that's key, that we're getting outside, getting more bursts of sunlight, and supplementing if you need to. Exercise. So I think everybody is nature deficient and exercise deficient. We're in front of our screens too much. We're on, in the car, on our phones, watching TV. I think that has to be something that we very much focus on, because it wasn't something that you had to really think about that much 50 years ago. I mean, you just went outside and play. You didn't have all these screens to take up your day, and so we have to be real cognizant of that.
As a kid, it was torture and my punishment to stay indoors. Now it's like the exact opposite. So that makes perfect sense. Vitamin D, get outside, play more, interact more. Is there a third that you see frequently?
I would say...
I'm sure sleep's high on your list.
Sleep's on the list. I mean, I don't know if it's deficiency, but just toxins, like just toxic overload, and not thinking about toxins. So slathering things on your skin, too much sunscreen, too much chemical, makeup, buying products without thinking about what's sprayed on them. I think that's a huge one in terms of a small change that you can make that ultimately leads to a major change in your health.
And with vitamin D, Dr. Joe, when do you recommend supplementing?
American Academy of Pediatrics, they recommend, for everybody. But I think that, again, it's one of those recommendations that's weird because you shouldn't need everybody to have vitamin D. I mean, we should be getting it from the sun. Ultimately, we should be recommending to try to get more sun. So that's really my recommendation for kids, and I don't tell people just to take it all the time. But I think realistically, a lot of people are deficient. So if you want to do a little bit of vitamin D, I think of all the things, that's probably the number one easiest recommendation with very minimal risk. So you can certainly do it if you want to, or just do it every once in a while to get some extra, but ultimately get outside. Same thing as food. It's like, do you want to get a supplement? Not really. You want to get it in food, but that's not the world. So I think we have to think about supplementing in the short term and really focus on fixing the food in the long term.
And I don't think there's been an episode that's gone by where we haven't said, and we will continue to reiterate, but in some cases it's hard to eat yourself into therapeutic range, especially with things becoming more and more deficient, so such as vitamin D. And if you're not getting the sun exposure, to your point, supplementing is probably second best. Before we move on to viewer questions, though, as we come to the end of the show, I love what you've postulated. You've argued for sort of this team-based model of pediatrics, so like very similar to dentistry. I've heard you say this before. What does that look like in practice, and how does that ultimately change outcomes for families? What's the invitation for that narrative anyway?
Yeah, I would love to see that team-based approach. It's very hard in modern medicine because doctors have such a short time with patients. Doctors are cramming more and more patients into just a few minutes, and ultimately you can't spend the time on all the stuff that we just talked about. You can't spend the time on nutrition or diet or thinking about root cause or thinking about their home or what's there. I mean, those take half hour. They take an hour. They take hours to discuss, and you're never going to go anywhere with that in 3 minutes. It's much easier to say, here, take your Tylenol, and I'll see you later. Right? And that's where we are, and that's why, it's a big part of why medicine and medications or pharma, I guess, is such a big part of medicine, because it's so much easier to say, take your Tylenol, than it is to have a discussion about what other things you could do at home, what you could look into, how you could support yourself naturally. So I think the solution to that ultimately would be a team-based approach. It would be like when you go to the dentist, if you think about it, you go and you see the hygienist, and you're with them for like half hour, 45 minutes.
One of the first ever, by the way, professional preventive practitioners ever in North America. I mean, this is traditional Chinese medicine probably predates them by thousands of years, but a hygienist looks for things happening before they happen.
Right,
Truly
and they talk to you about how do you brush your teeth and how to floss, and they go through all of this stuff. I mean, if they're good, then they do, and you have the time to do it. And then your dentist, waltzes in and looks at the X-ray and goes blah blah blah. Okay, your teeth are good. See you later. Or here's what we need to do. And that is more realistic, I think, in medicine, because it's not like there's enough doctors for everyone to spend an hour or two with each patient. But and also a lot of doctors just don't know this stuff. Like, we're not taught it, and I don't think I know even 1/1,000,000th of what a nutritionist knows about nutrition, right? That's what you're trained in, that's what you know. So you don't need to know everything, but you could theoretically set up a system where for your well check, you go into a place and you see the nutritionist for half an hour, and you see the occupational therapist for 20 minutes, and you talk about exercise with the exercise scientist for 10 minutes. Like, you could have that happen. Obviously, that's not the system we have now, but it is possible to be done. And ultimately, if we focus on prevention and we funded it and we covered it, then in the long run, we'd have a huge benefit because people would be healthier. And it's not impossible, because private practices and these health clinics that pop up, that's what they do. They spend a lot of time with you. It costs people money because insurance doesn't cover it, but that is the model that is even starting to grow outside the medical system, and it has a lot of benefit. We've seen that. So I think we could theoretically model it, but it has to be a priority because you'd have to cover it, and then it would be expensive, obviously, to do in the short term.
Wouldn't it be nice to see that was Maha's next initiative, to try to at least implement a model of which goes? So, we wish we had Dr. Gator here for another 3 hours to pick his brain. I saw you, though. I know you well. You had what? You have to get this one more thing.
Yeah. No, it just sort of wraps up everything you've been saying, and we talked about it yesterday, where this whole posture of modern medicine has been genes versus environment. And the party line has pretty much been, no, it's genes. You're born with this lot. It's going to play itself out. That's it. That's your lot, this lifetime. And then along came epigenetics, looking at the environment, the effect of what we do, how we live, the food we eat, our company, the environment that we put ourselves in, and how much that impacts us versus the genes. So we brought up the study yesterday. Biggest study ever done, 475 million families. looking through genealogy, health and longevity genes versus lifestyle epigenetics. The outcome of that study was the genes were only 7% of the outcome. So 93% is what we do, what we eat, how we treat ourselves, what medicine we choose to use, how we apply it, and what we do. 90%. So that's the where the weight should be accented.
Yeah.
Non-fatalistic approach. Genes are not your fate. And of course, can't change them, but you can ultimately, expose your body to better things so that you manage how they're expressed. Yeah. So we get a lot of viewer questions on the show. We had a couple lined up for you. Why don't we take a second to go through those?
Sure. Great question. How do I protect my baby from toxins without going broke?
I think you're mindful of it. The first key, you don't have to go broke at all. You just think about it, right? When you're purchasing things, you look at the ingredients, you look at the labels, you try to become knowledgeable as best as you can on different chemicals and toxins, and you try to buy things that don't have those. Things like plastic. All right, we know that there are a lot of chemicals in plastic that are probably not very good for you. So don't cook in plastic. Don't store your food in plastic. Get glass. Do whatever you can to just be mindful of some of those things, and ultimately it doesn't have to be more expensive. Some things can be more expensive, but it doesn't usually have to be. And even things like house cleaners, you don't always have to buy the expensive 99% antibacterial killer. You can just use water and vinegar. There are things that are much cheaper sometimes that can be more natural and healthy, and things that have been done forever. So it's a mixture of those kinds of things. But being mindful is the key, and I think once you're aware, then you start to make purchases with that in mind too.
Ask questions, read labels. Question from Maria on Facebook's, my toddler is constantly sick, but what's normal?
Being constantly sick, well, if you go to daycare, the normal these days is being constantly sick. It's 3 to 5 viruses in a winter is pretty average. Kids can be sick for a week to 2 weeks. I don't know if that's the way it should be, but that's what the normal is these days. I think we're exposed to a lot of viruses, especially kids in school, and everybody sends their kids back too soon. So there's just exposed to everything. But mild colds, mild illnesses every few weeks if they're in school as a toddler isn't so abnormal. I mean, ideally you're supporting their immune system, keeping them out so that they can be stronger. And there are many kids I take care of that are not sick every 2 weeks. But I don't know that that's way outside the normal. What's abnormal would be going to the hospital all the time, needing antibiotics all the time. That would be complicated ones, right? Yeah.
We have so many nuanced conversations and deep dives today. Obviously, was vaccines and Tylenol, very timely. But we often come back to foundational, right? So it's a very simple tip that we can give folks today, isn't it? I mean, at the end of the day, the foundational tip, and especially the focus, which is from your book, Parenting at Your Child's Pace. Seeds. You talk about this all the time. You use whatever acronym you might want.
But it's really for parents being aware of that children are growing up in a different age. We have to understand the environment that they're growing up in. And if we do that and then take the active, be proactive, be preventative, look for maintenance and prevention rather than illness, then we can start doing those from the start. So look at the foods, like you've said, absolutely. Whole foods, clean foods, organic foods whenever possible. Clean the house out, of all the chemical-laden cleaners, additives, things like that. Look if your child needs supplementation on top. You can support the immune system very, very well with vitamin D and vitamin C very easily. And then sleep. Sleep is the great reset for the immune system. So if a child is not getting their sleep and there's too much screen time, that's also the setup for illness. We always end up with one big question at the end, put you on the spot. So, Dr. Warsh, if parents remember only one thing from today's episode, what should it be about raising children at their own pace during those first 3 years?
I believe that the one thing they should remember is that it's okay to ask questions. It's not woo-woo to have questions or concerns. Kids are sicker than ever, and the way that we're going to move forward is to be skeptical, ask questions, do some investigation, and take health into your own hands. The 3 minutes you have with the doctor is not going to keep you healthy. It might diagnose something. You might get a medication. That's great. But ultimately, we have to take that health back in our own hands, start to push back and focus on those small things, focus on the foundations, focus on the immune support. I think ultimately that's what's going to keep our kids healthy, and that's what we need to do right now until the system kind of hopefully at some point catches up and starts to focus back on health a little more than it has.
Great.
Wealth of information, Doc. Really appreciate your time here today. For more resources, everybody, you can check out Dr. Joel Warsh's books. Parenting at Your Child's Pace. Highly recommend. That was just, a year ago you put that one out, right? And theshotbook.com. And you can also follow Dr. Joel. Highly recommend this on his Instagram at Dr. Joel Gator. And of course, don't forget to subscribe, leave a review, share this episode with other parents who want to raise healthier, happy kids at their own pace. Dr. Gator, thank you so much for joining us today.
Thank you so much.